For most of your life, you were sold a story that whispered, then maybe shouted, that touching yourself, that natural urge was something dirty, shameful, childish, something you were supposed to grow out of, especially once those big birthdays, 50, 60, 70, started rolling past. Like it was some embarrassing habit you needed to finally kick to the curb. But here's the truth they never whispered in your ear. The one that gets buried under layers of awkwardness and outdated beliefs. After 60, masturbation isn't just okay or normal. It could be the quiet, essential difference between feeling vibrantly alive and slipping into a slow, preventable decline. For over 30 years, I've stood beside men just like you, listening, examining, treating. My name is Dr. David Lee. I'm a urologist and a professor of men's health, spending my days at places like Baylor College of Medicine. And in those decades, I haven't just seen diseases. I've witnessed the silent, crushing fallout of neglect, of shame, of generations of misinformation handed down like a bad inheritance. Too many good men, strong, capable, intelligent men, suffer not from unavoidable illness, but simply from what they were never told. The uncomfortable, unspoken reality? Most older men either masturbate in ways that are subtly harming them, or they've stopped entirely, believing the old myths. They don't realize that how you touch yourself, how often, and with what mindset isn't just about a fleeting moment of pleasure. It actively shapes your hormones, your heart health, even the sharpness of your brain. Yes, you heard right. One simple, natural act, done poorly or avoided, can quietly contribute to erectile dysfunction, deepen depression, and even increase risks for prostate problems. But here's the flip side, the powerful potential they never taught you. Done right, with awareness, it can boost testosterone, unlock deeper sleep, and keep your vascular system, those crucial pipes feeding your entire body, supple and alive. This isn't just about pleasure, gentlemen. It's about preserving your function, reclaiming connection to your own body, fighting back against the tide of aging right where it often starts, in the nervous system. In just a moment, I'll share 7 crucial truths about masturbation secrets every man over 60 should have learned decades ago. But first, ask yourself this. If one part of your daily routine, one simple, private act, held the key to better health, a brighter mood, and more vitality, wouldn't you want to know exactly how it works? Stay with me. What you're about to hear might genuinely reshape how you experience the next decade of your life. Before we go any deeper, if you haven't already, hit that subscribe button and tap the notification bell. This channel is dedicated to honest, science-backed health insights specifically for men navigating life after 60. Subscribing means you won't miss a single piece of vital information that could make a real difference. And if this message is hitting home for you right now, just type 1 in the comments below. If it's not resonating, type 0. Your honest feedback is crucial. It helps me create content that truly serves you, not just generic advice. Okay, let's get into it, starting with the first, often painful truth most men never hear, until it's already caused damage. Secret 1. Mindless masturbation can lead to numbness and ED. The way you've likely been doing it for years, maybe decades, feels familiar, routine, maybe even harmless. But after 60, that familiar routine, it can start working silently against you. This is the most overlooked mistake, subtle but insidious. And over time, the cost is far higher than you might imagine. Let me share something I wish more men felt safe enough to admit. Hundreds of patients, men in their 60s, 70s, and beyond, have sat across from me. Often, there's a palpable shame, eyes down, voice barely above a whisper. And after building trust, when the conversation turns truly honest, I ask, "Do you masturbate?" There's almost always a pause. Then the confession, "Yeah, but I don't feel much anymore." Or, "I can only finish if I do it exactly this way." Or the one that haunts me, "Doc, it's like my body just forgot how to feel." What they didn't realize was that their approach, rushed, mechanical, disconnected, often paired with scrolling through intense imagery, wasn't just a habit. It was actively training their nervous system into dysfunction. They were unknowingly creating a neurological conditioning loop. Every time they rushed through the act, shoulders tense, using the same hand, the same motion, chasing the same quick outcome while bombarding their brain with overstimulating visuals, they were wiring their brain to associate arousal only with that very specific artificial routine. The brain learns fast, gentlemen. Too fast. And the consequence? Sensitivity drops. Erection quality begins to fade. You might find you need more stimulation, more pressure, more extreme visuals just to feel what you once did effortlessly. Responding to a real partner? That becomes harder, maybe even impossible. Intimacy starts to feel off, too slow, too unpredictable, too real. You might even start avoiding it. And this is where the real damage sets in, not just physical, but deeply emotional. I've watched capable men spiral into frustration, shame, and even depression, convinced their body is irrevocably broken. But here's the crucial insight. Often, their body isn't broken. It's been overtrained in the wrong direction. This conditioning can manifest as porn-induced erectile dysfunction, PIDE. It can cause delayed ejaculation, taking frustratingly long to climax. Or, in severe cases, anorgasmia, the inability to climax at all. These aren't rare fringe conditions. They're silently affecting millions of men, and the cruel irony is that most never connect it back to the unintentional habits they've ingrained. The absolute worst part? When you condition your body this way and don't reverse course, it's not just sex you lose. You lose confidence. You lose the deep sense of connection to a partner and, critically, to yourself. You begin to retreat. Your relationship with your own body turns cold, distant. You might avoid touch altogether, pull back from closeness. For too many men, that creeping isolation becomes the gateway to darker places. Emotional numbness, persistent low mood, and research increasingly suggests links to even earlier cognitive decline. I've seen this pattern again and again. The price isn't paid only in the bedroom. It's paid in your spirit, in how you carry yourself, in the way you might stop looking at yourself in the mirror. You slowly begin to disappear. Now, hear me clearly. I'm not here to shame you. I'm here to wake you up. Because the powerful, hopeful truth is this: your body can relearn. Your nervous system can heal. But it requires awareness, patience, and crucially, a new way of approaching self-pleasure. One that's slower, conscious, deeply connected, not just to physical sensation, but to emotion and presence. Masturbation itself isn't the enemy, but doing it mindlessly, mechanically, that's like putting your car in gear and stomping on the gas without steering. Eventually, you crash, and by the time you notice the damage, the repair takes far longer. But while mindless masturbation causes harm, there's something equally dangerous, often cloaked in societal approval, hiding in plain sight, and it's praised as dignified. That brings us to the next secret. Secret 2. Masturbation reduces prostate congestion and inflammation. There's a quiet, pervasive myth that whispers once you hit 60 or 70, you should just shut the whole system down, pack it away. I remember a patient, let's call him David. He was 68, proud, reserved. Came to see me because he was getting up 5, sometimes 6 times a night to pee. He described constant pressure, a feeling of fullness, even a dull ache deep in his pelvis. He sighed, "Guess it's just old age catching up." Document. What he didn't expect was my next question. "David, when was the last time you ejaculated?" He blinked, taken aback. "Years," he finally admitted. "Haven't been with anyone since my wife passed. And honestly, Doc, I thought men my age were supposed to stop doing that." That right there is the damaging myth. The body doesn't magically turn off its biological functions at a certain age. When you stop ejaculating, your prostate doesn't get the memo. It keeps diligently producing fluid, part of semen. If that fluid isn't released regularly, it builds up. Think of it like a stagnant reservoir inside you. This buildup is prostate congestion, leading directly to inflammation, discomfort, and, over time, significant health risks. Your prostate gland isn't designed for indefinite storage. When it's chronically full and inflamed, it swells. That's when symptoms hit. Urinary urgency, a weak stream, dribbling, even pain during urination or any eventual ejaculation. Most men, like David, write it off as inevitable aging. In reality, it's a plumbing system dangerously backed up under pressure. Now, let's talk seriousness. Chronic inflammation anywhere in the body is a known risk factor for various problems, and the prostate is no exception. While abstaining doesn't directly cause cancer, frequent ejaculation helps flush out old fluid and reduces the inflammatory environment within the prostate. Multiple studies support this. The most compelling? A large-scale Harvard study published in the Journal of the American Medical Association followed nearly 30,000 men for years. The findings were clear. Men who ejaculated 21 or more times per month had a significantly lower risk, about 33% lower, of developing prostate cancer compared to those ejaculating only 4 to 7 times per month. This wasn't a small sample or a fluke. It's robust data suggesting a protective effect. The theory is that ejaculation helps clear the prostate ducts of potential carcinogens or inflammatory agents. Back to David. Once we talked openly, once he understood the biology, not the myth, he made a change. He began touching himself again, not driven by lust or loneliness, but by a sense of self-care. Slowly, steadily, his symptoms improved. The pressure eased. His sleep became uninterrupted. And something more profound happened. A light returned to his eyes. He was reconnecting with a vital part of himself he thought was lost forever. The cost of neglecting this is not just restless nights. It's chronic pelvic pain, reliance on medications for urinary symptoms, potentially invasive procedures later, and yes, potentially contributing to a higher risk environment for prostate problems, including cancer. You wouldn't ignore your heart pounding irregularly. You wouldn't ignore sky-high blood pressure. Don't ignore the health of your prostate. It's a vital part of your male physiology. But what about the emotional baggage? The shame David initially felt? That shame itself, the years of guilt and silence, actually worsens the physical symptoms. That's where the next secret takes us. Secret 3. Shame around self-touch damages your mental health. There's a heavy silence that hangs over many older men in my exam room. It's not in what they say, but in what they don't. It's the averted gaze when I ask about sexual health. The slight slump of the shoulders when the word masturbation comes up. The nervous laugh, the quick subject change, or the muttered, "Doc, that's not for me anymore. That was for younger days." But beneath those words, I hear the unspoken truth. Often, they didn't stop because they wanted to. They stopped because they were taught, implicitly or explicitly, that continuing was somehow wrong, indecent, undignified. This shame, this quiet, internalized judgment, is corrosive. For decades, many of you grew up in eras where self-touch was labeled dirty, sinful, weak. Maybe you were punished, ridiculed, or simply made to feel deep embarrassment. Those early messages don't vanish. They burrow deep into your nervous system, shaping your relationship with your own body for life. The result? Profound disconnection. You might crave touch yet recoil from it. You might see natural desire as something inappropriate, something to suppress. You stop reaching for yourself not from lack of want, but from a conditioned belief that you shouldn't. This disconnection isn't just emotional. It has tangible biological consequences. Regular, healthy sexual touch, including mindful masturbation, is a powerful regulator of mental well-being. It helps modulate cortisol, the primary stress hormone, boosts dopamine, associated with motivation and reward, and fosters oxytocin, the bonding or trust hormone, crucial for emotional regulation and connection. It's linked to better sleep quality, improved mood stability, and even enhanced cognitive function. It's a natural stress reliever and mood enhancer. But shame? Shame actively disrupts this potential. It tightens your muscles, spikes cortisol, and creates insidious guilt loops in your mind. Shame is chronic stress. And chronic stress? It's a well-documented driver of anxiety, depression, heart disease, weakened immune function, and research increasingly points to links with cognitive decline and dementia. The shame surrounding self-touch isn't just an emotional burden. It's a physiological one. actively harming your overall health. I recall another patient, 72, recently widowed, sinking into a deep depression. No major illnesses, no medications initially, just an overwhelming numbness and isolation. He confessed he hadn't engaged in any sexual activity, solo or partnered, in over a decade. "I just thought that chapter was closed," he said, his voice thick with unspoken grief. It wasn't just grief for his wife. It was grief for the loss of his own embodied self. We worked together slowly. No pills. Just simple, non-judgmental exercises to help him reconnect with his own body. Touch without guilt, without pressure, focusing on sensation and presence. Within weeks, a shift began. His posture straightened. Sleep improved. He started laughing again. His blood pressure, previously creeping up, normalized. He wasn't cured of grief, but he was reconnected to his own aliveness. That's the insidious price shame demands. Your vitality, siphoned away drop by drop, convinces you you're too old to feel desire, too old to feel pleasure, too old to feel whole. But that's a lie. You are never too old to touch yourself with kindness, dignity, and purpose. You are never too old to reclaim your sense of wholeness. And if shame can inflict this kind of damage, consider what happens when hormonal shifts combine with it. Because your testosterone decline isn't just a passive effect of aging. It accelerates when you disconnect from your sexual self. That's our next critical truth. Secret 4. Testosterone is stimulated by sexual activity, even solo. There's a fundamental misunderstanding most men only grasp when it's too late. Something I shout from the rooftops whenever I can. Testosterone, the hormone fueling your energy, strength, drive, confidence, and yes, sexual desire doesn't just fade solely because you add another candle to the cake. Yes, age plays a role, but here's the crucial part they miss. Testosterone also plummets when you stop living like a man who expects to feel alive. When sexual energy is ignored, suppressed, or buried under shame and inactivity, your body receives a signal. He doesn't need this anymore, and it starts dialing down production. Think of it like a muscle. If you stop using your arm, the muscles atrophy, the nerves quieten. Your masculine vitality system works similarly. Without engagement, without the neurological and vascular signals generated by arousal and orgasm, even solo, the body reallocates resources. Muscle tone diminishes. Belly fat becomes harder to shift. Sleep becomes fractured. That essential spark, the drive, the assertiveness, the sense of core identity, begins to flicker and fade. Not because you're chronologically old, but because your body hasn't been reminded that you're still functionally vital. I treated a man named Frank, 73, a retired firefighter who once radiated strength. When he came to me, he was slumped, perpetually tired. "Just slowing down, doc," he shrugged. His blood work revealed the story. Testosterone levels barely above the threshold for clinical deficiency. When I gently asked about sexual activity, he just shook his head. Don't see the point anymore. That belief that his sexuality was obsolete was the real accelerator of his decline, far more than the number 73. We started simple, not with partners, but with himself. Mindful reconnection, presence over performance, curiosity over critique. Over the ensuing months, something remarkable happened. Not only did his testosterone levels rise significantly into a healthier range, but his entire demeanor shifted. His posture improved. His voice regained its resonance. He started light weight training again. The light returned to his eyes. His body was responding to the renewed attention, sending signals back to his brain. We're still in the game. Keep the fuel coming. This isn't just anecdotal. Studies show measurable, short-term boosts in testosterone following sexual arousal and orgasm, even when achieved solo. Research also indicates that erotic thought, physical engagement, and even the anticipation of pleasure can positively influence hormone regulation, mood, and motivation pathways in the brain. Your body is exquisitely designed to respond to pleasure, connection, and presence. When you give it nothing, it slowly stops offering anything back. The cost of low testosterone is profound and extends far beyond the bedroom. Increased risk of heart disease, type 2 diabetes, osteoporosis, cognitive fog, persistent depression, and even a shortened lifespan. It's not just a number on a lab report. It's a core indicator of your overall biological engagement with life. Tragically, many men never realize how far they've drifted from their hormonal vitality until it feels impossible to regain. But it is possible. It starts not necessarily with medication, but with reclaiming your connection to your body on your terms. And if testosterone is vital, the next system we need to talk about is even more fundamental to daily function. And it operates strictly on a use it or lose it principle. Secret 5, erectile function is a use it or lose it system. A dangerous assumption creeps in for many men past 60. If I'm not having sex with a partner, why do I need to worry about erections? That part of life is over. I hear variations of this constantly. Men dismiss concerns about weakening erections or lack of morning wood because they believe they've aged out of needing that function. This, gentlemen, is a critical misunderstanding with serious consequences. Erectile function is not just about penetrative sex. It's a complex, vital barometer of your overall vascular health, nerve integrity, blood flow efficiency, and yes, longevity. It's a high-performance system demanding healthy blood vessels, robust nitric oxide production, responsive nerves, and supple tissue. Neglect it and it will deteriorate rapidly. Consider Harold, 69. Sharp mind, active life. But he'd gone 5, maybe 6 years without a single full erection. Not because he physically couldn't achieve one initially, but because he saw no reason to. Widowed, not dating, he believed that chapter was closed. What he didn't grasp was that his body wasn't patiently waiting for his return. It was actively dismantling the unused system. Without regular erections, the engorgement of the penile tissues with oxygen-rich blood, the smooth muscle within the corpora cavernosa begins to atrophy. The intricate network of tiny blood vessels loses elasticity and efficiency. Nitric oxide, the crucial chemical messenger that triggers the relaxation necessary for blood inflow, diminishes. Fibrosis, the development of scar tissue, can begin, literally hardening the spongy tissue. Here's the brutal truth no one tells you. This disuse atrophy happens whether you're sexually active with a partner or not. If your body doesn't experience regular arousal and erection, it assumes the system is obsolete and starts reallocating resources. Over time, even if desire or opportunity returns, the physical capacity may be significantly diminished or gone. The damage isn't just physical, it's deeply psychological. As the body loses its ability, confidence erodes. Self-worth takes a hit. You feel less like yourself. This often leads to withdrawal, depression, and studies suggest it can even correlate with earlier cognitive changes. What's the solution? Remind your body the system is still needed. Regular erections, achieved through mindful self-stimulation or even non-sexual nocturnal erections, which maintaining vascular health supports, are essential maintenance. They pump oxygen-rich blood through the penile tissues, keeping them supple, stimulating nitric oxide production, and preserving neural pathways. This isn't about chasing constant arousal. It's about preserving a fundamental aspect of your physical health and masculine identity. It's sending a biological message. I'm still here. This system is still vital. Harold learned this starting a gentle, mindful practice. While full function didn't return overnight, significant improvement did, restoring not just physical capacity but a sense of agency he thought was lost. Now, if maintaining erections naturally is this important, what common modern habit actively works against it, numbing your natural response? That brings us to a sensitive but essential topic. Secret 6. Porn changes your brain, but you can take control. Let's talk about pornography. I know it's uncomfortable. Saying the word might make you shift in your seat. But if you're still here, please hear me out. This isn't about morality. It's about neurobiology and its impact on men over 60 specifically. Many men in their 60s, 70s, and beyond confide they use porn. Often, it's not about obsession. It's about connection or the memory of it. Loneliness, isolation, the lack of a partner. It becomes a readily available, albeit artificial, stimulus. But here's the critical point almost none realize. The pornography widely available today, high speed, high intensity, novelty-driven, is neurologically light years away from the Playboy magazines or softcore films of their youth. It's designed for hyperstimulation, and the aging brain is particularly vulnerable to its effects. Every time you consume this kind of intense, fast-paced porn, your brain gets a significant dopamine hit, the reward chemical. Over time, with repeated exposure, your brain adapts. It becomes desensitized. Natural stimuli, the touch of your own hand, the imagination, the presence of a real partner, simply don't provide enough signal to trigger the same response. You need more intensity, more novelty, more extreme content just to feel the same level of arousal. This is neuroplasticity in action, your brain literally rewiring itself based on what you feed it. The consequences are predictable and devastating for natural erectile function. Difficulty getting or maintaining erections without porn-induced erectile dysfunction PIDE. Difficulty reaching orgasm with a partner or even with solo touch without the artificial stimulus. Delayed ejaculation or even situational anorgasmia. Real intimacy feels underwhelming, even boring, compared to the digital fantasy. The cost? Profound frustration, deep shame. What's wrong with me? Relationship strain, and further withdrawal. Tragically, most men never link their diminishing natural response to the very thing they're using to try and feel something. But here's the powerful, hopeful counterpoint. Your brain is adaptable at any age. You can retrain it. You are not permanently broken. Healing begins when you consciously step back from artificial, hyperstimulating content and allow your nervous system to reset. Reconnect with real sensation, your own touch, slower, more mindful. Engage your imagination. Relearn the subtle, nuanced arousal that comes from within or with a real partner. This might mean a 30-day reboot from all visual porn for some. For others, it's a gradual reduction and shift towards less intense material or focusing solely on sensation. The goal isn't to eliminate pleasure. It's to reclaim it, to make it authentic and responsive again, rooted in your physical reality. If porn numbs your sensitivity, the final danger is the most profound of all: complete disconnection. The death of touch itself. Secret 7. The most dangerous mistake: isolation. Among all the risks facing older men, one stands out as uniquely destructive: isolation. Not merely living alone, but the deeper, more insidious isolation where you stop being touched, stop touching yourself meaningfully, stop connecting to your own physical being. It happens subtly, often cloaked in the belief that men my age move on from that. I remember Peter, 76, a precise, retired engineer. Polite, put together, but there was an emptiness in his voice. He matter-of-factly stated he hadn't been physically touched. Not a hug, handshake, pat on the back, in over a year. He said it not with sadness, but with resignation, as if it were an inevitable, closed chapter. What Peter, and so many others, tragically misunderstand is that touch is not a luxury. It's a biological necessity. Human beings are wired for connection, for physical contact. When we go without it for prolonged periods, our nervous system downshifts. Oxytocin, the bonding hormone, plummets. Stress hormones, cortisol, creep up and stay elevated. Blood pressure rises. Sleep quality nosedives. Immune function weakens. And perhaps most damaging of all, the brain, in a protective but ultimately harmful response, begins to dampen emotional and sensory circuits. We start to go numb, physically and emotionally. We lose the spark of aliveness, the urgency to engage with the world. This isolation often starts in the most intimate space, your relationship with your own body. When a man stops touching himself, not just for orgasm, but for connection, presence, simple acknowledgement, his brain interprets it as a retreat. A signal that this aspect of the self is no longer valued. Over time, this withdrawal becomes self-reinforcing. Touch less, feel less, believe there's nothing left to feel. The cost is catastrophic. A direct link to increased rates of depression, heart disease, cognitive decline, and significantly higher mortality. It's not age killing you. It's the slow death of connection, often initiated by self-abandonment. The antidote? Reclaiming touch, giving yourself permission to reconnect. Mindful self-touch isn't about chasing an orgasm. It's about claiming your body as still yours, still worthy of attention and care. It's sending a powerful message to your nervous system. I am still here. I still matter. I still want to feel. I've witnessed remarkable transformations in men who broke this silence. Posture straightened, eyes brightened, energy returned. They didn't just feel better physically. They felt present again. Peter began this journey, slowly, starting with simple, non-sexual self-massage, relearning the sensation of his own skin. The change wasn't overnight, but the spark began to return. Conclusion, the call to reconnect and outro subscribe request. If you've stayed with me this far, thank you. This isn't easy territory. I'm speaking to you now not just as Dr. David Lee, the urologist, but as someone who has sat across from countless men, heard their unspoken fears, their quiet regrets, and sometimes their flickering hope. We haven't just been talking about masturbation. We've been talking about something far deeper. Your fundamental relationship with your own body as you age. How you carry your history, your vitality, your sense of self in these later chapters. And crucially, whether you're willing to challenge the narrative that your sexual, emotional, and physical vibrancy has an expiration date stamped by society. We confronted the damage of mindless routine, how it trains numbness into your nerves. We exposed the myth that stopping ejaculation is dignified, revealing how it congests and inflames the prostate, backed by hard science like the Harvard study. We tackled the silent poison of inherited shame, how it strangles mental health and physical well-being. We debunked the passive view of testosterone decline, showing how disengagement accelerates it, and how reconnection can help turn the tide. We emphasized that erections are a vital health marker operating on use it or lose it, crucial far beyond partnered sex. We navigated the complex impact of modern porn on the aging brain and the path to rewiring sensitivity. And finally, we confronted the deadliest threat of all: isolation, the complete withdrawal from touch and connection, leading to a cascade of decline. The core message? You are not broken. You are not obsolete. You are not invisible. Every system in your body, even now, yearns to respond to connection, presence, and care. Your brain can still light up. Your heart can still open. Your skin can still remember what it means to feel alive. This reclamation doesn't require a partner, a prescription, or permission from anyone else. It starts with you. It starts with a conscious choice to stop shrinking, to stop apologizing for wanting to feel good in your own skin, to reject the lie that age equals disappearance. For men ready to begin this reconnection, I offer a simple, powerful starting point, what I call the Golden Protocol. 10 minutes a day, quiet, private, intentional, not goal-oriented towards orgasm, but focused on mindful touch, breath, and awareness of sensation. Explore different pressures, textures, temperatures. Notice without judgment. Reacquaint yourself with your body as it is now, with kindness. For some, this becomes a grounding morning ritual. For others, a calming pre-sleep practice. Almost invariably, it becomes a turning point. Because when a man touches himself with genuine care and curiosity, not habit or desperation, something fundamental shifts. The body remembers. The spirit softens. The spark of vitality begins to glow again. Reclaiming this isn't just about sexuality. It's about reclaiming your wholeness, your right to feel vibrantly alive, engaged, and connected for every single day you're given. That journey starts right here, right now, with you. If this conversation resonated, if it sparked something or challenged long-held beliefs, please let me know. Type "why" in the comments below. Your engagement fuels this vital work. And if you want practical guidance, like a deeper dive into the Golden Protocol or more science-backed strategies for thriving after 60, make sure you're subscribed and that notification bell is on. Don't miss out on the insights that could make your next decade your most vibrant yet. This is Dr. David Lee, signing off with a reminder: your vitality is worth fighting for. Start today.